Well, I just want to kind of bring you up to date the relationship between your medical doctor and the pharmaceutical industry. Between 2009 and 2012, when the survey was done, major drug companies paid, it says here, tens of thousands of U.S. doctors, $2.1 billion in, quote, consulting fees. Right. They can't give kickbacks anymore, so they've reclassified them consulting fees. And, of course, what they've learned to do is with these $2.1 billion consulting fees, they really should be called consorting fees instead of consulting fees. And basically, what it is these doctors, they go to their state monthly medical meetings or their state medical organizations, and they give out free samples to the other doctors and say, hey, look, I can get you some free lunches delivered every Friday to your office, to your staff, by these pharmaceutical companies if you use these drugs. You can have a new Mercedes in your driveway if you just prescribe these drugs. And so these guys are more than consulting. They are consorting, okay? And it's absolutely criminal, but they've learned how to use the lingo to kind of dodge the bullets. So the way to deal with it is don't use them. Well, you say, well, my doctor says I need these drugs. No, you don't. Listen, this just came out, it has to be last year. 1.5 million deaths and permanent injuries every year. 1.5 million deaths and permanent injury every year in America as a result of prescription errors. And I'm not talking about the side effects of the drugs. I'm talking about prescription writing, decimal point errors, writing two prescriptions together that should not be given together to the same patient. I'm talking about the pharmacists who fulfill the drugs incorrectly, either by dosage or actually drug. Let's say a pediatrician does a good job. He diagnoses strep throat in a 3-year-old kid, prescribes some penicillin drops to give that 3-year-old baby. But instead, he gets busy, so he turns it over to his assistant, or maybe he does it himself. He's on the phone taking somebody else's prescription, and he puts the prescription that he's taking off the phone into that baby's bottle of drops instead of a penicillin. He puts in chemotherapy for a 300-pound man, kills a kid. Everybody gets a walk. 1.5 million each year from these types of errors killed and injured, fatalities and permanent injuries. You wouldn't tolerate that in any other industry. What if, because one of these fast food restaurants fried their food incorrectly, and they killed and injured 1.5 million customers every year? They wouldn't be open 3 seconds. But medical doctors get away with it because they're a protected monopoly that's self-policing. So what I propose is you do like me. Now, I haven't been to a doctor with me being the patient for 67 years. I've not taken any prescription medications in my entire life. What I do, of course, is I take the 90 essential nutrients twice a day for my body weight, and I've been doing that for 67 years. My pulse is normal, 43. Doctors freak out. They say, you got to be on drugs. No, I'm not. It does spike up. When I get angry or frustrated, it'll spike up to 45. When I wrestled from the University of Missouri, my wrestling pulse was 38. And, of course, I've been taking the 90 essential nutrients twice a day since I was 9. So, in a couple of months, I'll be turning 75. So what this all means is that if you give yourself all the raw materials, you're going to reduce your risk of disease, your quality of life will be way up there, and you'll be able to avoid doctors. Just think of it. What if every person in America only went to a doctor once every 75 years like me? The medical system would be real humble, wouldn't they? But you have to be obsessive. People say I'm obsessive because I take the 90 essential nutrients twice a day. So I'm taking double what would normally be, considered the minimum for my weight. And I do that purposely because I have a big schedule. I give 300 free lectures a year plus my 2 hours of radio, and some days I do 3 or 4 other radio interviews and TV interviews for local events. And so I'm a very busy guy. I write books. I write scientific articles. I do health consulting to patients on the phone, maybe 30, 40, 50 a day. And so I'm a very busy guy. And so I need more nutrients. So why wouldn't you do the same thing? Well, my doctor says I don't need it. Nah, that's because he's one of those guys getting part of that $2.1 billion every year for writing prescriptions with pharmaceuticals. So what I urge you to do is get a hold of that book, Let's Play Doctor. It's actually an e-book as well as hard book. You can get it either way, an e-book or hard copy, Let's Play Doctor. And learn how to do your own laboratory tests. Do your own screening every month, every 6 months. You're going to be your own second opinion. Why wouldn't you do your own screening yourself? And that way you're going to make sure that you get diagnosed properly. That book will tell you how to translate all your own numbers. It'll tell you how to do your own allergy test for free. It'll tell you how to actually see if you have little wormy parasites or one-celled parasites. Tell you what to do if you have parasites. You can do all that yourself. Well, yeah, I went to the doctor and he said it was all in my head. Did he do a stool exam? No. Well, then he should be put in jail. Okay, if you think you have parasites, you need to have a stool exam. If you don't want to do it yourself, in the book, Let's Play Doctor teaches you how to do it. What you do is you take your own stool sample to the veterinarian, tell them it's from your dog, and for $10, whatever it is, they'll do it. But you can do it for free. Just read the book, Let's Play Doctor, either, again, the ebook form, Let's Play Doctor, or the hard copy, Let's Play Doctor. Learn how to read all your own laboratory reports you've been collecting for all these years. You don't know how to read them. Well, the book Let's Play Doctor teaches you how to do that. That's why it's called Let's Play Doctor. Well, stick with us. We're going to be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us?
I thought we'd talk a bit about thyroid cancer, as I have a Fox News story here that's headlined, "Thyroid Cancer Cases Soar. Is it overdiagnosed?" I say there's been a dramatic rise in thyroid cancer from overdiagnosis and treatment of tumors that were too small to ever cause any harm. According to a study, they found a number of cases has tripled since 1975. They say the study is the latest to question whether all cancers need aggressive treatment. They say there's research that suggests certain cancers, such as prostate, breast, and lung cancer, as well as thyroid, grow so slowly that they will never really become deadly. And there's just been too much overzealous screening, leading to overtreatment. And they go on to say that it's a hormone gland, and that if you have problems it uses to regulate the metabolism, they say with thyroid cancer, often includes surgery, the removal of the gland, followed by lifelong daily hormone pills. They go on to say that the thyroid removal has done 85% of all those diagnosed, despite guidelines that say less aggressive surgery is reasonable for lower-risk thyroid tumors. According to one of the co-authors of this most recent study, Dr. Gilbert Welch, professor of medicine at Dartmouth Institute for Health Policy and Clinical Practice, says our old strategy of looking hard as possible to find cancer has some real side effects. And goes on to say that patients can no longer assume that labeling a disease as cancer means treatment is necessary. And in the study, they analyzed government data from 1975 to 2009 and found thyroid cancers jumped from 5 cases per 100,000 people to 14 per 100,000. Most of the increase was in papillary thyroid cancer, the most common and least deadly kind, and those cases jumped from 3 cases per 100,000 to 12 per 100,000. This was all published in the online version of Journal of American Medical Association's otolaryngology, and they say that despite the increased thyroid cancer, relatively uncommon, more than 60,000 cases are diagnosed last year, according to the American Cancer Society. And interestingly enough, it says that it's generally risk factors are thyroid cancer include diets low in iodine, which are rare in the U.S., and radiation exposure. They say women are more commonly diagnosed than men, and I have to wonder, Doc, maybe it's all those mammograms they're getting and the radiation they're exposed to there.
Yeah, all that contributes, absolutely. And, of course, cruciferous vegetables. Everybody's supposed to be eating lots of broccoli and cabbage and all that kind of stuff. Well, those things actually contribute to thyroid problems. Cruciferous vegetables, cabbage, broccoli, cauliflower, Brussels sprouts, kale. Eating them once or twice a week is no problem. But you eat them for breakfast, lunch, and dinner, and for snacks, it's a real problem. So you have to watch what you eat there. And, of course, it helps to not only take your 90 for life appropriate for your body weight, the Healthy Start Pack, 1 per 100 pounds of body weight per month, but also to reduce your risk of all kinds of cancers. In fact, that's one of my lawsuits against the FDA, which I prevailed in federal court, was to be able to get claims that say you can reduce your risk of many types of cancers significantly by supplementing with selenium. And also, supplementing with selenium increases your body's ability to manufacture anti-cancer substances like glutathione. And so that's another reason to supplement with the selenium, their ultimate selenium from Longevity. Take 3 twice a day per 100 pounds of body weight. So I take 9 a day of our ultimate selenium. And between the selenium, I get something else. I get 1 milligram a day. That's 1,000 micrograms a day. The government only recommends 50 micrograms. And so by taking 50 micrograms, you're way, way, way underdosing. Of course, that's the minimum daily requirement. So you can deal with all this stuff. Stay away from processed meats with nitrates and nitrates. They also increase your risk of thyroid cancer. But I think part of that increase is just doctors need a Mercedes payment, and they can tell women what to do, and women believe them. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Kansas. And Sue, you're on with Dr. Wallach.
Hello, Sue.
Thank you. Hi, Dr. Wallach.
How can we help you?
Recently, I have this swelling around my knee, and some of it feels like water on each side of my kneecap, but in the back, I've developed this hard knot that it's not painful really, but it's getting bigger all the time. It's just happened in the last month, I'd say. So it's not causing me any pain. I'm very active, but I just want to get rid of it.
Sure. Okay, does it feel like a water balloon, filled water balloon?
No, it feels hard.
Okay. Is it movable?
Not really.
Okay, well, I'd have somebody look at it. I'd go to a chiropractor or somebody who's non-invasive like that and have them look at it and see what that is. Oftentimes, people get a Baker's cyst there, but it feels like a water balloon. Even though it's tight, sometimes it'll be like a water balloon. If it's hard, it could be something else, anything from a bone spur to a calcium deposit to maybe even a ruptured tendon or ligament that's just knotted up. And so it's worth having somebody who knows about bones and joints to have a feel of it, and maybe even take an X-ray or an ultrasound. Ultrasound be no radiation, very economical. So you want to call around, make sure whoever you go to has access to a high-resolution ultrasound. That's what I would do, see what it is, and then give me a call. But what do you weigh?
I weigh about 125.
Okay, well, what I would do in the meantime is take one healthy bone and joint pack per month, divide it in half, take a half a dose of the 4 products at breakfast, a half a dose of the 4 products at dinner time. I would also get an extra bottle of glucogel. That way you'll be able to take 15 glucogel a day, 5 at breakfast, lunch, and dinner. And that presumes, obviously, something's going on there in that joint, whether it's cartilage or ligaments or tendons, connective tissue, tendon or ligament sheaths, which might, again, be a Baker's cyst. So find out what it is by a high-resolution ultrasound. Take the healthy bone and joint pack, throw in the extra glucogel, and then call me as soon as you get more information. We'll be back after these messages.
Let's head to Alabama. And Anthony, you're on with Dr. Wallach.
Well, Anthony, you're on the air. Hello, Anthony.
Going once, going twice. Let's move on to Texas. And Marion, you're on with Dr. Wallach.
Well, Marion, you're on the air.
Hey, Dr. Wallach, please forgive the background noise. We just flew into Sacramento, me and my daddy, and we're headed to Stockton.
All right.
I'm calling on one of my dear friends. She was diagnosed with stage 2 invasive ductal breast cancer. She's currently on chemo. She's got hot flashes with her chemo. She's got fatigue and dark circles under her eyes. She's got constipation, decreased appetite, and she says she's getting a lot of gray hair. And she's got ADHD. She's 5'8", she's 213 pounds, and she's 38 years old.
Now, did you say 113 pounds or 213?
213.
213 pounds, okay. All right.
Amen.
She's how old?
38.
38. All right. All right. Well, she's got to change everything, right? That's what got her in trouble.
Yes.
She cannot eat any burnt meats, nothing cooked well done. No fried foods whatsoever. No processed meats with nitrates, nitrites. It means absolutely no deli slices, sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, and jerky. Also, she needs to give up all gluten. No wheat, barley, rye, or oats. No wheat, barley, rye, and oats. I mean, everybody in the household, including the dog and the cat and the bird and the fish, men, husband, boyfriend, mother-in-law, mom, kids, everybody in the household has got to be gluten-free because of cross-contamination in the laundry, the food preparation surfaces, the bed, the couch where they watch television, everything. There cannot be any gluten in the house. All right? Then I would also give her, by body weight, 2 of the Healthy Heart and Brain Packs per month. 2 Healthy Heart and Brain Packs per month. I'd get her an extra bottle of our Ultimate Selenium, and that will allow her to have 3 of our selenium 3 times a day. 3 at breakfast, 3 at lunch, 3 at dinner. Selenium is one of your best friends for your immune system when you have cancer or other terrible diseases. So that'll give her 9 a day, 3 at breakfast, 3 at lunch, 3 at dinner. That will give her an ounce of the OsteoFX Plus twice a day, an ounce at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast, and 2 of the 2.0 Beyond Tangerine 2.0 NutriCrystals at dinner, 3 of the EFA Pluses at breakfast and dinner, 3 of the EFAs at breakfast and dinner. All that would be accomplished by the 2 healthy heart and brain packs per month. It would also get her 2 quarts a month of what's called Z Radical, Z like zebra, dash, and then the word radical. It's a blend of super juices, and it has per ounce 50 milligrams of fucoidan, which is a substance that has an enormous amount of studies, like 840 studies, may even be 900 studies by now. And basically, they looked at this because the Japanese have so little breast and prostate and colon cancer compared to Americans because they eat this stuff all the time. And it's just really great for supporting the immune system, for stimulating stem cells to grow and encourage growth of healthy tissue. And so that's where I would start her. And give me a call every couple of weeks. Give me more information. We'll walk you guys through this. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 90 for Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. And it's toll-free, 1-888-379-2552. And tonight in Stockton, California, we're having a big event. It's the 3rd annual Crab Fest at the Stockton Ballroom on Thornton Road, Thornton Road in Stockton, 5:30 p.m. And, of course, all proceeds go to the Defying Muscular Dystrophy nonprofit organization that is using the Youngevity program for kids and young adults with muscular dystrophy. And we've been doing this now for almost 2 years. And let me tell you, the results are just outrageously good. Of course, you're going to be hearing a lot more about this as we go along. And we're replacing the Jerry Lewis Telethon with the National Muscular Dystrophy Association because they fired Jerry Lewis and they collapsed after they stupidly did that. Okay, and so we're here to fill in the gaps. We're going to save these kids. Our kids aren't paraded back and forth showing on braces and just begging for money. Our kids are paraded back and forth showing that they don't have muscular dystrophy anymore. A little bit difference in the approach. Okay, well, Doug, let's go to callers.
Let's head to Michigan. And Susan, you're on with Dr. Wallach.
Well, Susan, you're on the air.
Hi, Dr. Wallach.
Hi.
Yes, I'm 5'2.5" tall, 105 pounds. For about 10 years, I've had rheumatoid arthritis. I have osteoporosis. I have some candida issues. In the last couple years, I've seen quite the deformity taking place in my fingers and my toes. Like I said, and I did hear you on Benny Hinn and wondered if possibly the mycoplasma upper respiratory infection type deal is going on, and if the secret sauce would work or whatever.
Absolutely. Exactly. And, of course, you got the message. Rheumatoid arthritis is not an autoimmune disease like medical doctors will tell you. Certainly it's not dumb luck. Rheumatoid arthritis is actually caused by an infection with a bug called mycoplasma, which is typically a respiratory bug. But when you get high levels of that mycoplasma floating around in your bloodstream, it likes to set up housekeeping in your joints and produces what we call rheumatoid arthritis. Now, this bug is killable in 2 weeks with an antibiotic called minocycline, like the bait fish, minocycline. It's a member of the tetracycline family. You can kill that bug in 2 weeks, very easily killed, just like you can kill the syphilis bug with penicillin in 2 weeks. Very similar concept. But you're still going to have the deformity in your fingers and toes and osteoporosis and candida because the antibiotics just kills the mycoplasma bug. All right? Now, and so to deal with that, there's 2 things we can do. Number one, I prefer to use a blend of herbs we call Killer Biotic. The 8 herbs in that blend actually will support the immune system. 2 of those herbs have antimicrobial properties, so you can use the killer biotic 3 twice a day per 100 pounds of body weight, along with the minocycline or by itself. Takes a little longer to get the results you're looking for if you use the killer biotic by itself, because you have to depend on your own immune system kicking in. And then what I like to do is per 100 pounds of body weight, and so you weigh 105 pounds, this will work. I want you to take 1 healthy bone and joint pack per month, but I also want you to get an extra quart of the osteo and an extra bottle of the glucogel, because I want you to take 1 ounce of the Osteo FX Plus at breakfast and dinner. You get 1 scoop of the Beyond Tangerine 2.0 NutriCrystals at breakfast and 1 scoop at dinner time. The 3 EFA Pluses that come per day in those kits would be 1 at breakfast, 1 at lunch, 1 at dinner, or 1 at breakfast and 2 at dinner, however you want to do it. And then 15 glucogel capsules a day. Those 2 large bottles, ones that comes with the Healthy Bone and Joint Pack, and the other one you're going to get will allow you to have 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. And they're designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. And so this is my approach to rheumatoid arthritis. We have some just really outrageously successful results with this. And it's just amazing how many people, even if they've had rheumatoid arthritis for 23 years, very deforming rheumatoid arthritis, usually within a month or so, they're just totally no pain anymore without pain medication. And the healing begins right away, of course. And depending on the degree of deformity, deformities can be resolved because, again, of the support and promotion of maintenance repair of the joints and ligaments, tendons, connective tissue, cartilage. 4 to 6 months, I've seen really, really gnarled up people after 1 year. They can play the piano like a concert pianist. You look at their fingers, you never know that they were all gnarled up previous to that. The Candida, I would go ahead and get on a gluten-free diet, absolutely no wheat, barley, rye, and oats. It's going to increase the absorbability, efficiency of the supplements you're going to be taking. And also, oftentimes people are diagnosed with Candida for a variety of reasons. One is they might have a systemic Candida, but Candida is kind of a Me Too bug. It's one of those things that is a secondary bug. It really doesn't cause disease by itself. When it flourishes, it means there's something else going on there. And so I would get on a gluten-free diet, no wheat, barley, rye, and oats, and oftentimes that plus the nutrition to support your immune system, your Candida load in your blood and your skin, every opening in your body will just drop right down into the normal range. It's a normal bug, but when it increases to the point where a doctor is going to diagnose that you have Candida, that means you have something else going on, okay? So in my experience, it always turns out to be, guess what, gluten intolerant. So get away from wheat, barley, rye, and oats. Everybody in the household's got to be free of gluten. And then call us in 2 weeks and 4 weeks and 6 weeks, if you would, please, Susan. Give us an update, and we'll walk you through this. Okay, Doug, let's go to callers.
Let's head to California. And Carolyn, you're on with Dr. Wallach.
Oh, Carolyn, you're on the air.
Hi, Dr. Wallach. As they say in radio speak, I think we're at the bottom of the hour, but I am 70. I'm a war baby, roughly contemporaneous with you, and I'm hanging on by my fingernails if I had any left, but my history would cover a wall of shame for medical things. But at this point in time, and I have a sort of an education. I've been fighting the system for years, intuitively trying to go alternative.
Well, welcome to the Youngevity family.
Right now I have what is, I guess, MEN, multiple endocrine neoplasia, and most recently, recurrent primary hyperparathyroidism that was triggered 12 years ago, again, by medical malpractice, after years of being injected or orally given corticosteroids, which I thought, when I was perimenopausal, catapulted me back into this. And this is the brief version. Right now I have every ism and indrum.
Okay, well, let's stop there a minute. Okay, stop a minute. Tell me, when you say you have all these different malignancies, name me a couple.
Well, there's MEN is, it can be, recurrent adenoma parathyroid tumor, huge fibroid. I had my hysterectomy in my 30s, fibrocystic breasts, fibrocystic ovaries. I studied for years.
Okay, I gotcha. And we only have a couple of minutes here, so I want to really give you some answers. So what I need you to do is tell me how much you weigh,
Well, because they gave me Cushing's, my weight went from 130 a few years ago to 175. I'm back down to about 150 now, but I was just under 5'8", and I'm 5'6".
Okay. Okay, so you've shrunk 2 inches.
My hair is falling out, my teeth are rotting, my gums are receding, every organ system.
Okay. All right. Do you have any history of skin problems, any eczema, dermatitis, psoriasis, or rosacea?
Yes, I've been listening to all your articles. When I was born, I wasn't breastfed. I was given formula of cow's milk, and I looked at my baby book later, and I had severe infantile eczema. It finally cleared up, and in fact...
Okay, well, hang on here, Carolyn. We got to run one of those information moments. Get your pen and paper ready, because when we come back, I'm going to give you a diet change and a lifestyle change and a supplement program, because everything you have is a nutritional deficiency. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go right back to California and Carolyn. All right. Because you have so many problems here and you had childhood eczema, the odds are 100% that you have a gluten intolerance. That's the basis for all of these myriad of health problems you have, because they're all nutritional deficiencies. And we don't have to worry about the fibrocystic fibroids in your uterus anymore because you had a hysterectomy, but the fibrocystic breast disease we can deal with. So absolutely no inflammatory foods, no gluten, no wheat, barley, rye, and oats. You have to live in the gluten-free aisles in the grocery stores. Everybody in the household, including the fish and the bird and the dog and the cat, have to be gluten-free. Everybody else, every human, mother-in-law, husband, boyfriend, kids, brother and sister, whoever's living in the house has got to be gluten-free, so there's no cross-contamination in the bed, the couch, the food preparation surfaces, and the laundry. Then at 150 pounds, I'd have you take 2 of the healthy bone and joint packs, because the hyperparathyroidism is caused by raging calcium deficiency as a result of secondary malabsorption, because your intestines are damaged because of the gluten intolerance. So I want you to take 2 healthy bone and joint packs per month. That's 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of Beyond Tangerine NutriCrystals 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 of the glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 healthy bone and joint packs per month. Because you have a history of all these sort of overgrowth things, these dysplasias and precancerous stuff, I'd go ahead and take 9 of our selenium a day, 3 at breakfast, 3 at lunch, 3 at dinner. That's 3 bottles a month. And don't forget, gluten-free, no fried foods, no processed meats and oils. And then give us a call every couple of weeks. If you would, please, Carolyn, we'll walk you through this. Okay, Doug, let's see if we can squeeze in another one.
All right, let's head to Alabama. And Paul, you're on with Dr. Wallach.
Well, Paul, you're on the air.
Well, hi, Dr. Wallach. Actually, my name is Carl. It's K-A-R-L, not Paul. It's Carl. And I heard about you on Benny Hinn.
Okay.
And I am a type 2 diabetic.
Okay.
I have already ordered, I think it's called the Healthy Start, which what they told me was all I needed for the to reverse diabetes. And what I have is the Osteo FX. I got the Tangerine. I got the EFA and the Sweet Ease.
Okay,
and
perfect.
I got
what do you weigh, sir?
Double pack because...
Yeah, how much you weigh?
225.
Okay, a double pack is perfect. So what you do, you got to give up sugar, obviously. That includes dried fruit, fresh fruit, and fruit juices. No molasses, honey, agave syrup, maple syrup, none of that kind of stuff. And then I would have you take 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the NutriCrystals Beyond Tangerine at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the Sweeties twice a day. All that will be accomplished by the 2 healthy blood sugar packs. And take your fasting blood sugar every morning before you medicate yourself, and you're going to find that your blood sugar will drop. And when you get down below 100 with your blood sugar 5 or 6 days in a row without medication, you're an ex-diabetic. This can happen in 2 days, 2 weeks, 2 months, but it's going to happen. And if you're a type 2, it's very, very easily to deal with, because this program will support and promote healthy metabolism of carbohydrates, sugar, and fats at the cellular level, will support and promote healthy blood sugar levels, and of course will also support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. So you're going to get a lot of side benefits that are going to amaze you. Noisy joints will get quiet. Range of motion problems, suddenly now you'll be able to extend your joints and bend your joints like you haven't done before. Blood pressure can come down. All the side effects of malabsorption, all the side effects of nutritional deficiencies, you'll be amazed. If you would please, Carl, call us every 2 weeks. Let us know your blood pressure, let us know your blood sugar levels, and let us know if you're still on your medication. And, of course, do not cold turkey off your medication. Just reduce it as you've been taught to do based on the numbers. Keep a logbook so you don't forget things. We look forward to hearing from you. Thank you so much, and God bless you. Thank you for bringing up the Benny Hinn thing, which was really a great, great experience. He's just a wonderful guy. But thank you, everybody. Really great testimonies and questions. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.